Hi everyone, it's Val. I'm a nursing student here in Arizona. I'm trying this go live thing because it's a lot easier than me making a video, trying to download it, trying to edit it, and do all this stuff. So, hopefully nothing crazy happens while I'm live on YouTube. I wanted to talk about NCLEX style questions. Someone had asked me, I think it was on a Facebook group, about NCLEX style questions and if they're the hardest thing or like the hardest part about nursing school and stuff like that. So first of all, I want to say that when I do like a study review and I utilize an NCLEX style question tool, it needs to have a reference. The book, the PrepU, the whatever it is that I use, it has to have a reason why the answer is the answer. It has to give me evidence-based practice. It has to give me proof. It has to give me some sort of reason why that answer is the right answer. A good reference is a reference that has another reference to it where you can find out for yourself, right? Because we want to learn from our mistakes. And if they don't give you a reason why the answer is that answer, or it just doesn't make sense, then I don't think that's a very good reference to use, because we are in nursing school. We do want to be nurses. We're dealing with people's lives. So we don't want it to be, someone just saying that this is the answer, and then we remember that and we try that and it's wrong. So definitely look into that. Now, as far as NCLEX style questions, sorry guys, if my thing's moving, I'm in my room on my lazy boy. So I keep like rocking back and forth. But as far as NCLEX style questions being difficult, yeah, they are difficult. And I think the reason they're so complicated is because they're critical thinking, higher level questions, right? They don't just come automatically. I don't know how to explain this. Like before this, I was a teacher, and I used to work with students on curriculum-based things. So as being a curriculum coordinator, I worked with the older students a lot to get them to be successful in their AP classes and to be successful on their SATs and their PSATs and all of those. So that kind of standardized testing, it's very similar to the NCLEX, because you have a scenario and it has information that you need to know, information that's good to know, and then a bunch of extra information that you probably didn't need to know. And then the answers, they give you 4 possible answers, 4 possible solutions, and they're all right. They are all a possibility. They are all something that you would do at some point in your patient care in that scenario. Now, the thing is to prioritize. What is priority? What is a priority case for your patient? What is the most important thing that you can do for your patient? And I think that's really hard, because we think to ourselves, well, I would start the IV and do this and do that all at the same time. Like, yes, we would. And, but they want to know what would come first. If you could absolutely not do that, if you could just not do 5 things at a time, what is the priority thing for you to do according to that scenario? And I think that's what makes it hard. It's these suddenly now you have to separate, and you have to really think critically about what is priority for the case, what is priority for the patient. And I also feel that really makes it hard, because the critical thinking, it's part of a learning curve that we go through. I mean, you're going to hear a lot of people say that, if you think you know how to study, you don't know how to study until you get to nursing school, right? Or you're never going to study the same way, or I've never worked so hard to get a B before in my life. Like, to some degree, it is kind of true. And, you probably hear people saying that, oh, well, I get all A's all the time, and A's came easy to me, and then I went to nursing school and I failed. I mean, to some people that's true. That's what happens. And I think it's the learning curve. And the learning curve comes with this critical thinking skill that we don't tend to have right away as student nurses because we're still learning. We have the knowledge, we're learning the skills to get us through. And that's what these questions are trying to do. They're trying to assess your knowledge level and assess your skill ability to be able to treat that patient scenario in the best possible manner, in the best way known to evidence, known to what is out there. You're treating your patient in the best way. And that is what makes it so hard. I don't think the material is hard if you study it, right? Every question that I've ever missed on an exam, I've gone back and I've looked at it, and it was because I didn't read it right. I didn't understand the key term. I thought the key term was to assess, but the key term was to intervene or something like that. So it's really about reading it, and I never really had an issue with just absolutely positively not knowing the answer. Like, I've never gone to a test review and been like, wow, I really need to go back and look at that because I totally missed that. It was something that I just did not assess it the way that it should have been assessed. I did not prioritize the way it should have been prioritized, and it made sense, right? So that has been my biggest problem, is that it's really important for you to read when you have an NCLEX style question, you read the question first, because then you have an idea of what they're going to ask you. If it says, what is the next priority? What is your next step? What do you do after? What will you assess for next? What will you initiate for next? So that's what you need to be looking into. And then I read the information